The following video will give us an understanding of how a cervical spine epidural steroid injection, otherwise known as a CESI, will relieve neck pain and restore mobility. Dr. John Cho and Dr. James Chang are board-certified physicians with subspecialty certifications in pain management. Both Dr. Cho and Dr. Chang have advanced expertise in minimally invasive interventional techniques to treat both acute and chronic pain. During a cervical epidural steroid injection procedure, your physician injects a steroid into the epidural space around your spinal cord. This is performed under X-ray guidance, so the physician knows exactly where the steroid is being administered. Based on your symptoms and physical exam, if your physician believes that your pain is caused by inflamed spinal nerves, common indications for an epidural injection include, but not are limited to, herniated disc confirmed by an MRI, degenerative disc disease, radiculopathy, spinal stenosis, and overall muscle weakness. Remember, decreased inflammation equals decreased pain. Epidural steroid injections work to decrease inflammation in the spine. This can directly affect the nerves that travel from the neck into the shoulders, into the hands, and down the fingers. These nerves branch off of the spinal cord through the epidural space, which is why the anti-inflammatory is administered in this location. By eliminating the irritation around the epidural space, it will work to reduce the symptoms. Instructions on injection preparation will be explained to you by your care team. You may have the option to choose between local anesthesia or conscious sedation. Depending on what you qualify for, you may have restrictions on medications and food intake before the procedure. After the procedure, it is important to take it easy for at least 24 hours to allow the medication to begin working. You may be instructed to remain out of physical therapy or physical activity and return the following day. The benefits of cervical epidural steroid injections include getting pain relief, the procedure being minimally invasive, providing a better quality of life, improved ability to your day-to-day activities. It may also reduce the need for a more invasive procedure such as surgery or having medication management. I know what you're thinking. When will I begin to feel the pain relief? Well, everybody's bodies are different. You may feel immediate pain relief within 1 to 2 weeks of your injection. You will then follow up with your doctor 2 weeks post-injection to record all your results. If you experience increased pain post-injection, contact your doctor as soon as possible. Some others may ask, how long the epidural will last for? Some patients experience relief for up to 4 to 6 months. The epidural injection is unique to the individual based on the level of inflammation. Frequency of this injection is to be discussed with your physician. Visit us online at njsw.com or give us a call at 877-333-NJSW to begin your journey to a pain-free lifestyle with NJ Spine and Wellness.